On the Hematology, Oncology, and Bone Marrow Transplant Unit, we take care of kids with blood disorders, including sickle cell anemia, cancer patients, and BMT patients. It's the only ambulatory clinic at Children's Mercy that functions as a day hospital. We provide bedside nursing in an outpatient setting. It's a high-volume unit with anywhere between 40 to 80 patients per day. We have two sides to the unit. The Horn, or HEMOC RN, is where our nurses care for outpatient kiddos with scheduled chemo, lab draws, and more. Our clinic is staffed with nurses and other providers, including a child life specialist. The clinic team does a variety of procedures, such as labs and central line port access, lumbar punctures, bone marrow aspirates and biopsies, in addition to infusions. Our nurses are chemo and PALS Pediatric Advanced Life Support certified. Many also choose to get their CPON, Certified Pediatric Hematology Oncology certification. The unit has around 22 nurses who work varying schedules, designed to meet both the unit's needs and nurses' scheduling preferences. Shifts start between 7 and 8:30 a.m. and end between 3:30 and 6 p.m. No one works more than 4 days a week, and our unit isn't open on nights, weekends, or holidays. We work an outpatient schedule. We get to cultivate complex inpatient nursing skills. Our nurses usually have a background in oncology, but we do sometimes hire new graduates and nurses without previous oncology experience. Orientation can take 3 months or longer and is guided by our nurse educator and unit preceptors. We start new nurses on the Horn side of the unit until they are comfortable enough to staff the clinic as well. If you need something, someone is always there to back you up. This is a highly sought-after team. People stay for years and rarely leave. Several of our nurses have been here for more than 3 decades. When team members do move on, there's usually somebody waiting to take their spot. Our nurses are committed to supporting each other, patients, families, and providers. You can feel that passion when you step onto the floor. Our nurses start with yes. We take care of each other's patients, cover lunches, trade days, and pick up shifts. If your patient has a bad reaction, in seconds there will be 6 or 7 nurses in your room ready to help. You'll never feel alone. We rely on each other on the hard days, especially when we lose a patient, and we celebrate together on the good days. We form tight bonds with our patients and their families and love watching kids get better, grow up, and live big lives. It's so satisfying to take care of medically complex patients in such a supportive environment. There's really no better place to work.